Hello, Dr. Rotchford here again on topics in opioid use disorders. I think the topic tonight will be short and sweet and of great interest for many of the viewers. The subject is Probuphine. Probuphine is the name, the brand name of buprenorphine that has been FDA approved to be put under the skin. It's an amazing advancement, I think, in terms of our repertory of options for people with opioid use disorders. Let me explain why I'm so excited about it and why I want to share this with you. In previous discussions, I've brought up the notion that one of my primary objectives for patients early in recovery is to do what I can to help them make the medicines a non-issue. It's really a challenge, and sometimes it takes years for the medicines start to become a non-issue, both consciously and subconsciously, and I've talked about that before. So anything that comes along that helps me in this regard, I think, is a boon for the recovery. And here's the scoop. Someone who is a good candidate for buprenorphine therapy can have buprenorphine implanted under the skin in a pellet form that actually they're rods, four little rods, and commonly they're placed under the skin in the upper arm, but could be placed elsewhere. But basically they're there for at least 6 months, keeping steady levels through that whole time. But just think about it. You don't have to go to the pharmacy. You don't have to worry about refills. You don't have to worry about if your insurance is going to cover it, if you're going to be able to afford it that month. For 6 months, and likely more, you're stable. The medicines are non-issue. You can travel. You don't have to worry about your medicines getting lost or stolen or all the rest. Yes, it's a big step, potentially, in helping the medicines become a non-issue. Now, if you want to get into it and you're tweaked your curiosity, you can go to my website at drrotchford.com, drrotchford.com, under the handouts tab, and in the opiate use disorder section, you'll find several handouts discussing Probuphine, indications, pros and cons, risks and benefits, and the rest, and you can learn a lot about it as a potential option for you or a loved one. I'm sure there are other sources on the net as well, but there you go. So I'm always happy when I can share good news like this. And I want to add, I'm not getting paid anything for this from the pharmaceutical company that distributes this. No, I just think this is good news, and I love to share it. All right, thanks again. Till next time.